right, good afternoon, everybody. Thank you for coming to the COVID-19 Local Response Press Briefing. Today with us, we have Lisa Clute from 1st District Health Unit, Randy Schwan from Trinity Health, Lori Nishik from the Minot Municipal Court, Ron Merritt from the Minot Park District, and myself from Ward County Emergency Management. First up, we have Lisa.
Good afternoon. So this past week, we have had 4,216 tests done so far in our 7 counties, for the past several weeks, we have had 4,216 tests done in the 7 counties. 473 of those were done this week. 387 of those tests were conducted in rural communities outside of the city of Minot that we serve. We had 4 additional cases this past week, one in McHenry County, which was a confirmed travel. Ward County had 3 positive cases, 1 confirmed travel, 1 community transmission, and 1 that is believed to be a close contact. So our cumulative numbers are Botno has conducted 237 tests with no positives. Burke County has conducted 118 tests with 5 positive cases. McHenry County has had 244 tests with 2 positive cases. McLean County has had 519 tests conducted with 5 positive cases. Renville County has conducted 133 tests with 1 positive case. There have been 31 tests conducted in Sheraton County, and they have not had any positives. And in Ward County, we have had 2,934 tests conducted with 28 positives. So because half of the cases in North Dakota have been identified as from a close contact or household contact, that is why contact tracing is so important. And so when somebody is identified as a close contact to a confirmed COVID patient, they are contacted by us, by a case investigator. We do that fairly quickly. It's usually 4 to 6 hours at the most of when we are notified, and we reach out to those people or reach out to the patient that is identified as COVID, and we begin identifying all of those contacts. Those contacts are very important because we know that they have had close proximity for a period beyond 10 minutes to that COVID patient. So then we engage in the important task of contacting those close contacts. We reach out to those close contacts and we ask them to self-isolate, monitor their temps daily, and check in daily with us to see how they are doing. That has been where most of the cases have been identified, is through those close contacts. Now, we have had some unfortunate situations within the district that people have not cooperated with us when we've contacted them, and we have asked them to check in with us daily and so forth. I think it's important that the community is aware of that because we are trying to isolate them, but if they are not self-isolating, they may be out in the community, and even if they are asymptomatic, have the potential of spreading the COVID-19. So I'm letting you know that we are working hard on the contact tracing. We are making every effort, day and night, weekends, to contact them, but sometimes we are not successful. And we can use the force of law, and on occasion we are having to do that. It is a Class B misdemeanor, which is 30 days in jail and a $1,500 fine. So sometimes those contact tracers are contacting you from their home. So if it is an unusual number that comes up, they will leave a message, and please call them back. It's really, really important for you to respond to those case investigators so that we can help limit the spread of this disease. So I just want to urge you, for the health of the community, please participate and cooperate with them when you receive a call. Testing events continue to be planned. Last week at this time, we were announcing that testing events were being rescheduled, and testing capabilities were limited at the state. That has been all resolved, and testing events are gearing up for the upcoming weeks. I don't have a definite date and time to announce those, but we are working daily with the state to arrange for those schedules, and we will announce them as soon as we can. Again, those testing events will be focused on healthcare providers and emergency responders. So stay tuned. As soon as we have confirmed information, we will let you know, and we will be making those arrangements. But communities with emergency managers and our staff are beginning to plan in various areas. The way that is working is those testing requests are being sent into the state. I know of 4 testing requests that have been sent in from our district. Those are all reviewed by testing groups at the state, prioritized, and then assigned a date, time, and the number of tests that will be available. So, thank you again. Continue to be vigilant, practice social distancing, wash your hands, as always. Do all the things that we have done an excellent job in this community. I have to say, there are a few situations that people have not been cooperative, but for the most part, I am so proud of the communities that we serve and their efforts that they have taken on to stop the spread. And our numbers are showing that. So thank you, thank you. Keep up the good work.
Thank you, Lisa. Up next, we have Randy Schwan with Trinity Health.
Good afternoon. Just a few updates. First, I wanted to take a minute to congratulate and salute the awesome work of every healthcare system in the country and in local and regional for while they celebrate National Healthcare Week this week, National Hospital Week, National Nursing Home Week. So last week was the Week of the Nurse. Actually, that kind of ends tomorrow. And yesterday marks the start of National Hospital and Nursing Home Week. So now more than ever, the celebration gives us an opportunity to highlight caregivers and the way they, innovative ways that they respond to the needs of their community. And so we're very proud of them in our region. I have a couple of numbers for you on COVID patients in the hospital. We have 2 positive patients in the inpatient unit. We have a few more that are expected or suspected COVID positive patients and are waiting on confirmation through testing. We have a number of patients, I think 5, that are waiting testing to be transferred out of that unit into a different unit of care. So going well for them. I wanted to emphasize what, if I can tag on to what Lisa Clute just talked about washing your hands and social distancing. Another thing that comes up when you talk about asymptomatic patients and those who are positive or have not been tested but may be shedding the virus in the community, maybe around you at the time, maybe in the store or in this room, anywhere. Another way to protect yourself and that they can protect you is by wearing a mask. Let's not overlook the importance of wearing a mask. And that's why you'll be seeing some changes coming out this week regarding Trinity Hospital's masking policy. We've had a recommendation that you wear a mask if you're coming to the hospital, and we're flipping that to be more of a mandatory mask policy. You will not gain entrance to the hospital unless you bring your mask or other face covering. Doesn't have to be a mask. It can be a scarf. It can be some other article that you cover your mouth and nose with. But we take safety of our patients and staff seriously. And we know that asymptomatic patients, positive patients are walking around and don't know it. And they need to protect all of us by wearing masks. And so that's something you'll read about and hear about. Our visitor restrictions are still in place at our clinics, nursing home, and hospital. Part of the governor's Smart Restart did not include watering down of any of those healthcare restrictions. So there are still restrictions to see patients at the hospital, and we have them posted on our website. There's still a higher level of restrictions at all nursing homes in the state, and that's not changing. And there are visitor restrictions for our clinics as well, so I ask you to go on the website before you attend one of our facilities to see if you're eligible to come in. Wanted to give an update on COVID-19 testing. Again, if you have any symptoms of COVID-19, any at all, you're welcome to call our hotline, and get an appointment for testing. We will offer that test for any patient who has any symptom. And you can call 857-7817 to set up a time for that drive-in test appointment. For some reason, the number of testing is down this week. We've been running an average of 40 to 50 a day. This week it started out at 20. So we're about half at our run rate, and I'm not sure why. Folks are getting in, getting seen, and getting tested that day, typically, and so there's no reason to wait. I'd like to take a moment for a really important message to thank Mayor Sipma, Mark Vollmer, and the staff, and Minot Public Schools, and the Learning Tree Daycare for their innovative and quick thinking to set up healthcare daycare, not only for healthcare, but for all response workers, fire department, police department, healthcare in the community. When this first came upon this community, one of the things that we were very concerned about was that frontline workers, emergency workers, could not go to work because they had to be at home with their kids when schools closed. And it was a real concern. We were very concerned about that. And that group came together and created a child care facility plan that 30 or more of our teammates used at Trinity Health, so they could keep coming to work and go to work on the front lines in this important COVID-19 response. And in the next week or so, that the daycare operation will wind down in conjunction with the school year ending. So staff who are making other arrangements today for childcare going forward. It was a heroic effort and something that's deeply appreciated. Thank you very much. So as part of Governor Burgum's enhanced testing plan, Lisa Clute talked about how they'll be focusing on healthcare workers and first responders in the state. And we know that they're coming to Trinity Hospital soon. It didn't work out last week, but we expect it to be any day where we'll be helping, First District will help us to test staff in the hospital to, again, we welcome that effort and know that through that testing and identification, we'll keep our patients and our staff safer. I think that's all I have for now, so I'll stand for questions in a few minutes.
Thank you, Randy. Up next, we have Lori Nishik with the Minot Municipal Court.
Thank you very much. My name is Lori. I am here as one of the clerks at the Minot Municipal Court. Judge Beal is here with me as well and will be available for questions if there are any towards the end here. We're here to announce today that after 62 days of suspending our court sessions due to this pandemic, Minot Municipal Court will resume court appearances beginning Monday, May 18th. So that's this coming Monday, with very specific and specific changes and limitations to what our normal has been prior to this process. Our intent today is to provide information about those changes and limitations and to show how we're preparing for Monday's continuation of our court appearances. We've created a couple of very simple diagrams to provide a visual for you to see our process will be changing beginning Monday to keep our customers and staff as safe as possible. So I think for those of you that are online, you should be seeing a slide. And to start, I would just like to acclimate everybody to the location of the municipal court. Many people don't know where we're located. We are on the west side of the city auditorium. So that's where the entrance is to get into the court. And obviously that's a side that faces towards the police department. So if you're looking at that slide, you can see towards the top in the middle, the entrance. That's our normal entrance. So people would come in through that door. If you follow that first arrow, they would come into the lobby of the courtroom, and that's where the check-in process is. Once they've checked in, they need to wait in the lobby. We have a process where our court law enforcement officer, when we're ready to start court, will start scanning the people into the courtroom just to make sure that they don't have, it's a device to make sure that they don't have anything on them that's prohibited in the courtroom. So they're scanned in before they go. They then go into the courtroom, as you can see with the arrows there, and they select a seat on one of the benches that is provided. At this time, people sit together, they bring family, they bring friends, sometimes they come alone, but we do typically have a pretty full courtroom, at least in our pre-plan. The defendant, when called forward, they take their place in front of the podium that's marked defendant on that schematic, where they are right in front of the judge's bench so that they can discuss their case. So once they're finished there, they will return to the lobby area where they will get checked out. Any paperwork that we need to make copies for them or that type of thing, they will get those at the checkout time, and then they will exit through the door marked exit. So you can see there, it's a quite small space. There can be a lot of people in there, and there's two-way traffic that goes through there. So people are passing each other quite often and very close together. So moving to the next slide. In this diagram, you can see that we will be using the door to the south of our usual door, the door that's marked entrance. Upon entering, the customers will be directed toward the check-in office that we have available that you see down towards the lower left-hand side of the diagram. And that's an existing office that also has security glass in it, so that even though we are close to the people as they come in to check in, there is that security glass that does provide a barrier for protection. Prior to getting to that window, there will be X's marked on the floor to remind folks of the social distancing or physical distancing that needs to be done, as well as other signage around, about keeping hands clean, cover your cough, all the things that the CDC has recommended. Prior to getting to that check-in window, there is a hand sanitizing station. That's the little circle that's with the HS, that's for hand sanitizing. We will recommend that they sanitize their hands before coming to the window to gather their paperwork, if there is paperwork. So once they get their paperwork, we will give them a clean pen, and they will then be able to move over to, it's not shown on the diagram, but there will be a table past the checkout window where they can stop to sign their paperwork, and then we'll have a place for them to deposit their pens, which would now be considered dirty until we have an opportunity to clean them before cycling them back into use. So they will then be directed to select a chair along that back hallway, which is along the bottom. That hallway is over 100 feet, so we can get about 15 chairs in there easily at the distance it needs to be so that people stay away from each other. We will request that they stay in the same chair throughout their entire wait. And once they move from the chair, once they get called into the courtroom, those chairs will be cleaned. So they'll be ready for the next use. At the end of those chairs where you see the enter court, that would be the door that they would come into. However, we would have a law enforcement officer stationed there, and this is also normal procedure, where they will go through the same normal scanning and searching through any belongings if they have any with them. So before they go in, they will have had that check done. That court law enforcement officer will be wearing a mask, face shield, gloves, because that officer would have probably the closest contact to these people entering the court than anybody else. There is another hand sanitizing station available there, so before they go in the courtroom, they will be able to sanitize their hands. The courtroom clerk will also be masked and gloved. They will clean that defendant podium before or between each case and each defendant so that will stay clean. Judge Beal will obviously be sitting at the judge's bench, which would be more than 6 feet away from the defendant. She will not wear a mask, but there will be plexiglass. There already is installed a plexiglass barrier to protect both parties there. The reason we think it's important that she doesn't wear a mask is because we do have clients who are hard of hearing, and we want them to be able to see her entire face to make sure that there's good understanding about what she's trying to say to them. So the court clerk, again, will also have fairly close contact with the defendant, so we'll be wearing a mask and gloves and sanitizing pens and anything else that needs to be sanitized between each contact. We will also mark the benches in there for anyone in the courtroom observing. So we request that to be limited, but we understand that we can't keep people out of the public hearings. So once the appearance has concluded, the customer or defendant will be directed to that checkout window. And once they're checked out, they will exit through the usual exit door. And there will also be a hand sanitizing station available there, so they're able to clean their hands before they leave the court. So as you see, our plan here, we do have it planned out for a one-way flow. There'd be very minimal two-way flow or contact at all. And so we have plans in place for the physical distancing, the personal protective equipment, hand sanitizing, and surface cleaning as well. So to wrap this up, our final slide just includes some additional information and a basic summary of some of the points that I just made. Our court will be open only for those with court appearances scheduled that day. So we're not going to take anybody else that wants to come in for any other business. Rather, we would recommend that take place over the phone. So we will have little slips with our phone number on it, but we will just take the folks that are scheduled for an appearance that day. Appearances are scheduled either at 9 or 9:30, Monday through Thursday, and so that south door will be open or unlocked between 8:45 and 9:45 a.m. So 15 minutes prior to the start of our appearances and 15 minutes after the last scheduled time. We do encourage anybody to, I should mention one other thing. We are still working. We've been working in the office this entire time on a staggered basis. So the office is accessible by phone Monday through Friday, and that's 8 to 4:30. We ask those that are making appearances, to attend alone. Please, don't bring family members, friends, even children. If there's any way you can make a plan to not bring your children to court, we're just asking to minimize the number of people that come through every day. We understand that's not always possible, but we just ask that you try to do that. Also, if you have a mask, please wear your mask. We will be in masks, and if you have one, please bring your mask. We will have a limited number of masks available for those that don't have, or for anybody that may be showing some minor symptoms, but we certainly don't have enough for everybody to go around. So if you have a mask, please bring it. So as discussed, the physical distancing, we definitely think we have that covered. We're prepared for. We will adhere to all the recommendations of the Centers for Disease Control and Prevention. Hand sanitizing stations, again, there are 3 of them. They can be used by anybody at any time, and they will, obviously remain filled so that they are of use. If anybody needs to make a payment, there are 3 ways to make a payment. Since we won't have our lobby open, you can call in to make your payment over the phone. We take Visa or MasterCard, and you can see our phone number is listed there. You can always send it in by mail. It's the same address that we've had for a very long time. And there is a drop box. It's located inside the public entrance of the Minot Police Department, which again is just right next door. One last thing, if you want more information about resolving your case potentially outside of court, you can certainly call us for those options. Depending on the specifics of each case, there may be options, and we'll just review those requests on a case-by-case basis. We can also handle any questions for, if there's somebody in a high-risk category that isn't comfortable coming to court yet, and they may want to reschedule. We'll certainly work with people there the best we can. And both Judge Beal and I will be available for questions after a while. Thank you.
Thank you, Lori. Up next, we have Ron Merritt with Minot Park District.
All right, thank you for having me. I'm just going to give a few highlights here of what we have going on with the parks. One thing I want to get out there is that our programming registration is ongoing for summer programs. We're holding registration through May 15th. We may extend that deadline based on the numbers that we're having, but if you want to register for a program, please get on our website. You can do it all online if you wish at minotparks.com. You can also come to our office. Our administrative office is open if you need help doing the registration online, but you're welcome to do it electronically if you wish. So our office is in the Municipal Auditorium on the south side of the building off of the main parking lot off of Burdick Expressway. So it is open. We may look at extending the season and having a second season after July 1st based on numbers that we see and participation and interest. So we're looking at actually doing another season after this one. So we have programs including t-ball, art class, fitness gym, tennis, baseball, softball, and golf lessons out at Service Valley Golf Course. And all of those, most of those will be in large outdoor settings. So we'll be able to accommodate everyone and keep people spread out, but still have something for the kids to do this summer. So we're looking forward to that. Scholarships for all of these programs are available. No questions asked. Not a single person will be turned away due to financial difficulties. So if someone wants to participate, they don't feel they have the financial ability to do so, we have forms they can fill out. No questions asked. Nobody will be turned down or turned away. We just need to know how to let them access the program. So those are available as well. Just call our office or look online to take part in that. The Roosevelt Park Zoo opened this weekend. The weather wasn't great the first day, but some happy patrons came to visit, and on Sunday was Mother's Day, and we had fairly good attendance. And mothers are free at the zoo for the rest of the week. So we extended that. We usually do it on one day. We did it for the whole week so people can come when they wish this week. Outdoors, our parks and trails are all open. Our restrooms are now all open. We have hand sanitizer in all of them, but all of our parks that have restrooms available are open. We're doing extra cleaning 2 to 3 times a day with all of those to make sure that they're sanitized for everyone, and we're getting a good response to all of that. Our playgrounds are also available. We have, since the kind of the beginning of the warmer season, we have had a local oil-related company called New Coda. They came and steam cleaned our playgrounds before the season started, and then they have done it one time since then, and then our staff is also sanitizing the playgrounds a couple times a week with an approved sanitizer to use. You're still using all of these facilities and areas at your own risk. We ask that, if you don't feel comfortable using the facilities, to please, keep that in mind and not do so if it makes you uncomfortable. But for people that are comfortable doing it, they are available for everyone. We're also beginning to open our athletic facilities following state guidelines that are available. And as more guidance is made available by the state, we will adapt our operations as needed. And it sounds like potentially Friday, some more guidance is going to come out pertaining to some things that we do. So we're kind of anxiously awaiting that to see what else will be available for us to follow. So I guess that's all I have, and I'll be available for questions afterwards. Thank you.
Thank you, Ron. And up last, I just have a couple announcements on behalf of Ward County. Just a quick reminder that if you received your absentee ballot application in the mail, please return that so that you can receive your actual ballot, and return that also by mail or at one of the 7 drop boxes that are throughout the county. And along the line of parks, the Ward County parks, with the exception of Old Settlers Park, are all open and taking patrons at this time. This includes the canoe launch facility in Eastside Estates, as well as the fishing piers at Rice Lake and Nelson Carlson. And with that, we will stand for questions.
A couple questions for Lisa, please.
Lisa?
Taking a microphone. Taking a microphone.
Lisa, could we get a little bit more information on the people that you talked about? How many individuals are not cooperating with with contact tracing? What communities are they in, and can you tell us what you mean by not cooperating?
Yes. I will say that we were reaching out to 3 individuals. One of them was resolved last night, and there was a misunderstanding. 2 of them we have not been able to reach, or one we could not reach. The other one refused to participate. And he was towards the end of his isolation order. That was last weekend. So that's what information I can share with you.
When you say participate, do you mean like you know they are not isolating, or what does participation involve?
Participation means that they are recording their temps twice a day and answering the questions either on a computer program that allows them to self-report. So they would say if symptoms are changing. If we don't receive that information on that self-reporting, then we reach out to them. And sometimes it's a matter of tracking them answering the phone or being available. And the person that we did struggle with last weekend said no, he would not self-report, and then did not answer additional phone calls.
You alluded to the fact that you were using your authority to impose penalties.
We can use our authority to impose penalties.
Have you?
No.
You plan to?
Yes.
All right. With 1 or 2 individuals?
I will say that we plan to if we need to.
All right. And then the mass testing events, you say you requested 4. Randy let us know that there was at least one. Can you tell us where the other 4 requests are at this time?
Yes, Gina's asking about more information on requests. The requests that have been submitted from our area to the state are from Mohall and Botno and Bowbells, as well as from Minot.
I have a question for Randy. So yesterday, the governor talked about self-quarantining, and it's no longer 2 weeks, it's 10 days. Is that the same for healthcare workers?
So we're following the guidance by State Health Department that would be closely aligned with that in terms of quarantine and/or travel policy. He announced some changes to the state's travel policy as well, and we are aligning our policies to be in cooperation with that. So, yes.
The numbers that you mentioned of people in, you have a COVID unit, correct?
Correct.
You said there are 2 confirmed COVID patients, but then you mentioned that there were 5 people waiting to move out. So you have non-COVID patients in the COVID unit that you're waiting testing on, or?
So after your treatment regimen is been completed and it's been resolved, before you can be transferred to another off-site unit, you will have undergone another test. So we're waiting the results of those tests for that transfer to take place, but they are no longer considered to be COVID positive patients.
So you actually have 7 people in the unit, 2 of which are still positive.
Yeah, let me clarify that. So we have a unit that is specifically set up for COVID patients or suspected patients. We also have folks who might need an ICU bed that might be placed in ICU instead. So where those 2 patients are, I'm not going to get specific about their location, but we do have dedicated units and dedicated staff for those types of patients. And so right now in the hospital, we have 2 positive that are getting treatment, and we have a number that have been suspected or have signs of it but don't have confirmation yet, but we're treating as though they are COVID positive. And we have some COVID positive patients who are coming off of treatment and waiting to be transferred out of the hospital.
Have any of those patients received the convalescent plasma?
So I can't answer that. I'll talk to our Chief of Medical Staff, Dr. Jeff Sather, for that clarification.
So before I answer that, I just want to clarify the testing to send out. We have patients that are in the hospital that get tested to go certain places, such as a nursing home. So some of those pending cases might not even have suspicion for COVID, but actually be in the process of getting tested. So that's some of the testing waiting to go out. So to clarify that. So we've had 1 patient that has been treated with convalescent plasma here locally. I don't know any details about, their recovery after being treated or where they're at with that. That just happened in the last few days here. So we've done that one time.
Is there a certain criteria that has to be met before they receive the plasma?
So there's limited supply, and yes, there's criteria. I don't know the exact details around what that criteria is, but that's something that certainly can probably be looked up online.
I have a question for Lisa. There were 2 nursing homes in Minot that decided not nursing homes, but senior facilities that decided not to participate in the testing. And I know you can't divulge who they are, but were there reasons? Can you list some reasons why they decided not to do that?
I'm aware of one facility chose not to participate because they wanted to wait for the nasal swabs instead of the oral swabs. Obviously, the nasal swabs are easier to conduct the tests on with elderly people. And at the time, we did not know whether or not we were receiving oral or nasal. So that was one of the reasons that I was aware of.
And also, if a home does not do the mass testing, residents of that nursing home, do they still need to meet the one symptom in order to get tested? Or because they're in a nursing home, if they want tested, can they get tested?
I would imagine that they could be tested if they are in a nursing home, contacted Trinity, that they would be able to test them. Correct?
Yeah.
Yes.
I also have a question for Lori or someone from the court. I'm curious as to what kind of a backlog you have in cases.
So we have rescheduled cases at least twice. So we have some schedule out to July. We do still have room the end of June where we can add more cases. We also have a little bit of flexibility in the scheduling. For instance, right now, we do not hold court on Fridays. The judge has indicated that she is willing to, open up a Friday if we need to do that. Again, we just ask people to call us so we know what their needs are, and then we'll work with them the best we can to get them through.
Yeah, a question for Randy about the mandatory masks. Are you still asking people to make their own, like a scarf or anything like that? Or are you starting to hand out masks now that they're mandatory?
No, unfortunately, we don't have the availability of surgical masks to hand out to folks. We're conserving them for our own use. Obviously, nationally and locally, there's still concern about the supply chain relative to PPE, including masks. But we know how readily available they are in the community, and the fact that you don't need a mask to cover your nose and mouth. You can use a number of alternatives for that. So we would expect that visitors coming to the hospital would bring that with them. Sir?
Wondering if any healthcare providers are aware of the status of positive cases at Elmcroft and what the facility is doing to limit the spread.
I can't answer that. Perhaps Lisa, you can, but that's beyond my scope.
Yep.
Would you repeat the question again?
Sure. Wondering if healthcare providers are aware of the status of the positive cases at Elmcroft Assisted Living and what the facility is doing to limit the spread.
Well, the healthcare providers, meaning Elmcroft, yes, they would be aware of those positive cases. And as I understand at this point, they are following all the CDC recommendations, and I believe that there will be plans to retest in that facility in the near future.
Do you know if those cases are residents and/or staff? Do you know?
I can't share that.
Okay.
All right, one last call for questions. Seeing none, we will adjourn for the day. Thank you, everybody, for coming.